Hi, my name is Brooke Uhas, and this is my Week 7 Community Mental Health Agency report. This is for Dr. Bajaj's class, Preparing for Community Practice. So, the agency that I chose to do this report on is Fred Finch Youth and Family Services. They are a nonprofit behavioral health program that is in California, providing mental health and substance use treatment for children, adolescents, and transitional age youth. They do a lot of work with families as well. They operate programs that serve kids with serious emotional disturbances and co-occurring substance use and mental health issues. The target population is adolescents, so between the ages of 12 and 18. 18 is the cap. Typically, they will take people in when they're 17, and if they turn 18 while in the program, they are welcome to stay to finish out the duration of their treatment. They serve youth with co-occurring mental health and substance use disorders and are often seeing clients who are presenting with depression, anxiety, PTSD, behavioral disorders, and substance abuse. It's common for the kids who are coming in to be struggling with probation, special education systems, child welfare, and juvenile justice systems with a history of trauma, foster care placement, family instability, and psychiatric hospitalizations. The levels of care that they provide, because they have so many programs, they do a lot of different levels of care. That includes outpatient services. They do a lot of outpatient stuff with the families. Their program in San Diego, which I'm really focusing on today, is a short-term residential therapeutic program where kids are staying for several months at a time. They're typically stabilizing after a crisis. Um, and as you could see here, they offer that crisis stabilization support. And another thing to highlight is their community-based mental health services. So they aren't just providing care within the facility, they are also using community-based interventions, and provide a lot of referrals for after the kids leave their program. So the organization itself, Fred Finch, is a nonprofit. It is funded by San Diego County Behavioral Health Services. They also work with Medi-Cal state insurance. They receive state and federal grants, and they have contracts with departments such as child welfare and probation. Therefore, their services are little to no cost. Referrals are typically made by the county behavioral health system, schools, hospitals, crisis units, families, child welfare, and probation. And their program provides services in English and Spanish. Their treatment approach. So, with co-occurring substance use and mental health, it is really important to address these simultaneously. One typically cannot be treated without the other. They typically feed the cycle together. So it's really important to address them as one whole unit, right? Their approach is also integrated. So they utilize a lot of different models. They're not just, using one specific approach. They do provide trauma-informed care and utilize evidence-based models such as cognitive behavioral therapy, dialectical behavior therapy, motivational interviewing, which is typically used for the substance abuse piece. And they also provide family therapy and case management. So, an evaluation of their services, there are several strengths. They have that dual diagnosis care with that integrative approach, wraparound services, and coordination of care. So, they're not just providing care within, they are in contact with the outside therapist that the child was maybe seeing for 6 months prior to coming into their residential program. If there are medical issues, they are in contact with their medical provider and their doctor, their pediatrician, right? And they're often, especially when they get a referral from the school, they're in communication with the school, providing updates and even like um, helping the families navigate through, how their child is going to complete school and stay on top of things while also receiving the treatment that they need in order to, um, you know, have a healthy and supportive state of well-being. Another strength is their trauma-informed framework. So they're really focused on safety and support with their outpatient services, and particularly with the residential program. There's a lot of peer support, right? Because everybody there is struggling with something similar. So that can be really beneficial for the kids and their family involvement. I think that that is of utmost important when working with kids, is making sure that the family is on board and that they're getting the support that they need to support their kids, right? A couple limitations. So because this program gets funding from the state and from the county, and they work with Medi-Cal, there's often a wait list, right? Sometimes it could take months to get in to receive treatment. So, thankfully, they are so well known that they work with other programs and can provide referrals to other programs. And with the demand, right, they are a very reputable program. They've been around for a very long time. Um, we typically see high caseloads, which could lead to burnout in the therapists. It could lead to people being overworked, and a lot of mental health programs are understaffed because of funding too. So, those are just some things to be mindful of. There are so many other resources here in San Diego. The top three that I know of are Rady's Children's Hospital, San Diego Youth Services, and McAllister Institute. All three of them provide substance abuse treatment for adolescents, and work with those struggling with co-occurring disorders, the dual diagnosis stuff. Rades in particular provides crisis stabilization, crisis services, and inpatient care. San Diego Youth Services also offers crisis stabilization, and a key part of their program is their housing and runaway services. McAllister Institute is a residential program, and they also have an intensive outpatient program, and they are in network with Medi-Cal. Some potential barriers to care, there's always a lot of barriers to care, and to break them down, we've got structural, systemic, and developmental. So, structurally, we're seeing long wait lists, insurance eligibility issues, transportation challenges, and because we are working with adolescents and children, these kids need to have parental consent, which can be tricky when the parent themselves are struggling with mental health or substance abuse. Some systemic issues that we see come up that are barriers to care is the stigma around treatment, of course. There's also cultural mistrust of mental health systems, particularly with marginalized groups. And then we also have a fear of juvenile justice involvement and immigration concerns, right? If parents are undocumented immigrants, there can be a lot of fear surrounding taking their child to a facility to get treatment, right? Because they have to sign all of these documents, and it could spark a lot of fear within the parents. Developmentally, we see a lack of motivation in the children, sometimes for the parents, mostly the kids, though. Um, the kids often have a limited insight into their substance abuse, and peer influence can, really impact at the younger age in adolescence. Peer influence is strong. So, I think with that attached with the stigma can place a lot of fear in receiving treatment for kids. And then we also have family conflict or poor engagement. Personal reflection. So, something I really love about Fred Finch is their cultural responsiveness to care. They have bilingual services, they're really family oriented. They provide trauma-informed and evidence-based care and provide community-based interventions. So treatment doesn't just stop when they leave residential. They're providing community-based resources and referrals for the children and the families. They have such a huge focus on serving marginalized youth and low income communities. So they're really helping these underserved populations down here. And another key component is their coordination of care and wraparound services. So their communication with the schools, with probation systems, and child welfare department. And the ecological systems theory with its wraparound model is super critical. So that is it for me. Thank you so much for listening.